In this video, I'm going to answer one of the most common questions I hear from people dealing with sciatica leg pain. How long does sciatica take to heal? What most people don't realize is that sciatica does not heal on one single timeline. Acute sciatica and chronic sciatica heal very differently, and confusing the two is why so many people feel anxious and discouraged or unsure if they're actually getting better. In this video, I'll break down what healing really looks like and how long sciatica typically takes to improve, how to tell if your body's recovering on its own, and when it's time to seek the right kind of professional help. And if you stay till the end, I'll share 6 clear signs that tell you your sciatica is truly on the road to recovery, so you can stop worrying and understand what your symptoms are really telling you. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. This channel is for people dealing with chronic pain, like back pain, sciatica, neck pain, poor posture, headaches, and are looking for real lasting relief. You'll get clear step-by-step strategies to address the root cause of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do next. I upload a new video every week. If you're dealing with sciatica leg pain, the biggest question in your mind may be, how long does it take sciatica to heal? In my experience, most cases of sciatica do improve, and often faster than people expect. In many situations, sciatica heals on its own within 4 to 6 weeks, with many people noticing relief in just a few days or a few weeks. That's reassuring, but it's also where confusion starts. Because while some sciatica follows a short, predictable healing timeline, other cases do not. And understanding why that difference exists is the key to knowing what to expect for your case. This is where the healing timeline really starts to make sense. Sciatica doesn't heal the same way for everyone because there are actually 2 very different patterns. Acute sciatica is recent onset sciatica leg pain, often driven by inflammation or temporary nerve irritation. In these cases, improvement usually happens as the nerve calms down. Chronic sciatica is different. When sciatica leg pain lasts longer than 3 months, it's a sign that the nerve continues to be irritated. At that point, waiting it out is rarely enough, which explains why some people recover quickly while others feel stuck. If you're wondering why sciatica leg pain improves quickly for some people but lingers for others, the difference is usually what was happening in the body long before the leg pain even started. Sciatica healing time is strongly influenced by the condition of the lower spine, discs, and nervous system at the start of the injury. For example, someone in their 50s, 60s, or 70s have obviously lived much longer than someone in their 30s, and therefore have had more time for the physical stress, repetitive movements, poor posture, and past injuries to quietly accumulate in spine, discs. Those changes often exist without symptoms until the nerve finally becomes irritating. The specific cause of the sciatica also plays a major role. A temporary nerve irritation or mild disc inflammation can calm down relatively quickly. But when a disc herniation, spinal misalignment, or pelvic imbalance has been present for years, sciatic nerve healing time is longer because those conditions continue to irritate the spinal nerves that form the sciatic nerve. Daily habits matter too. Prolonged sitting, limited movement, and postural strain can keep re-irritating the nerve even while the body is trying to heal. Timing matters as well. When sciatica leg pain is addressed early, recovery is often smoother. When it's ignored or repeatedly flares up without correcting the underlying problem, healing is often slower. This is why sciatica healing does not follow one predictable timeline. One of the most important things to understand about sciatica leg pain is that there is a point where waiting becomes unhelpful. In the early stages, many cases of sciatica do improve on their own as inflammation settles and the nerve calms down. But when sciatica lingers, that natural healing process can stall. A common mistake is assuming more time will fix the problem, even when symptoms are no longer changing. If the sciatica leg pain continues beyond 2 weeks without steady improvement, that's often a sign the nerve is still being irritated. When symptoms last longer than 3 months, sciatica is considered chronic. And at that point, the body is no longer resolving the issue on its own. The underlying cause, whether it's a disc problem, spinal misalignment, anatomical leg length difference, or pelvic imbalance, is still present and continues to stress the nerve. This is when professional care becomes important, not because the pain is severe, but primarily because the healing process has stalled. The goals shift from waiting on healing to occur to identifying what's preventing recovery. Understanding this turning point helps people avoid months of frustration and gives clarity on when it's time to stop hoping and start addressing the problem directly. This is where chiropractic care can make a difference. Chiropractic care focuses on identifying and correcting these underlying issues rather than only managing symptoms. Over time, spinal distortions or imbalances in the pelvis and sacrum, including conditions like an anatomical short leg, degenerative disc disease, or spinal arthritis, can change how forces move through the lower spine. These changes place repeated stress on the lower lumbar spinal nerves. The nerves most commonly involved are L4, 5, and S1. These nerves exit the lower lumbar spine and sacral region and combine to form the sciatic nerve. From there, the sciatic nerve travels through the buttock area and down the back of the thigh and branches into the lower leg and foot. When spine, pelvis, or discs are not functioning properly in this area, these nerves can become irritated or compressed, leading to sciatic leg pain. Chiropractic care works to improve alignment, motion, and balance in the lower lumbar spine and pelvis, so pressure on these nerves can be diminished. By addressing the structural conditions that created the nerve irritation in the first place, the body has a better chance to heal more completely and reduce the likelihood of ongoing or recurring sciatica symptoms. Now I want to go over the 6 signs that tell you your sciatica is healing. As sciatica leg pain begins to improve, the changes often happen gradually. Healing follows clear patterns, and recognizing them can give you confidence that your body is moving in the right direction. Here are 6 signs, in no particular order, that indicate that your sciatica is healing. The first one is called centralization of the leg pain. This is one of the most important signs that sciatica is healing. Centralization means the pain begins moving out of the leg and closer to the lower back. When this happens, most people will experience less leg pain and a little bit more back discomfort. This is actually a positive sign, an indication of centralization. As healing continues, the back pain typically improves as well. The second sign is decreased intensity and frequency of leg pain. The pain may still come and go, but the overall trend is improvement rather than worsening. The third sign is improved back mobility. As nerve irritation decreases, your lower back begins to move more freely. Bending, standing up from sitting, and changing positions in general should become much easier and much less guarded. Sign number 4 is improved function and strength. Your back and legs start to feel stronger, and daily activities like walking, working, climbing stairs, or standing for long periods of time become much more manageable. The 5th test is called the straight leg raise test. This is a test that you can do on your own, or sometimes if you're with your doctor, they'll try this with you. It's typical in sciatica that when you have pain, with keeping your leg straight and trying to raise it up, it'll be much, much worse when it's early on. As the sciatica begins to heal, though, what will often happen is you'll be able to raise that leg much further, because as you put tension on a sciatic nerve and it's less inflamed, it'll feel much easier. Sign number 6 is a reduction in muscle spasms in the lower back and leg. Protective muscle tension and spasms decrease as the nervous system calms and healing progresses. These 6 signs together indicate that nerve irritation in the lower lumbar and tension in the sciatic nerve is reducing and the recovery is truly underway. I hope this video gave you clarity around understanding your sciatica leg pain and how long sciatica healing time can really take. When you understand what's happening in your body, the fear and uncertainty start to ease. If you found this helpful, like this video and share it so others dealing with sciatica leg pain can get the same clarity. If your sciatica leg pain is new and you're noticing steady improvement, continue to monitor and look for ongoing progress towards full resolution. But if you've had sciatica leg pain for more than 2 weeks and it's not clearly improving, don't wait to get it checked. A chiropractor can assess your spine and pelvis and see if there's an underlying cause contributing to sciatica and begin correcting it. Look for a chiropractor in your city who has experience treating sciatica with corrective spinal adjustments. If you've already been doing treatment and still have sciatica leg pain for more than 3 months, talk with your healthcare provider about whether your care plan needs change. Sometimes something as simple as full spine x-rays and a properly evaluated lower lumbar and pelvic alignment can make the biggest difference, and this step is often missed. Also, watch some of my previous videos on anatomical leg length discrepancies causing sciatica and gait-driven sciatica to see if some of the information I discuss applies to you. The ultimate goal is to find the true cause of your problem and correct it. If you have questions, please drop them in the comments below, and be sure to subscribe for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do next. And if you want some sciatica relief exercises that you can do at home while you're looking for professional care, go watch this video next.